Greetings, ladies and gentlemen. It is my pleasure and privilege to give you this message after successful completion of a major hypertension conference in Asia called Global Hypertension Summit, which is organized as an educational partner by IPC Pharmaceuticals. This was a major conference, the Global Summit on Hypertension and Comorbidities, that took place in Jaipur, July 11th to 13th this year. The conference has been in planning for several months, and it was designed to provide the state-of-art knowledge on hypertension and comorbidities and how the attending doctors can apply these advances in their practice to the benefit of the patients and their families. The Hypertension Summit, which has become a very annual event in the country, sponsored by IPC Pharmaceutical Company, has become highly awaited and a popular hypertension program. Somebody has commented that it is probably the best hypertension dedicated program, not just in Asia, but also globally. So let me congratulate our academic sponsors for their dedication and devotion to improve the health of the people by early detection and successful management of hypertension and comorbidities in clinical practice. Let me get back to the Hypertension Summit, which occurred this year. It was attended by nearly 700 delegates from all over the country who were in the audience for 3 consecutive days to learn about hypertension and to interact with colleagues and faculty about cardiovascular, cardiometabolic risk factors. Although I was the director of the program, I received a lot of help from my co-directors, Drs. Rabin Chakrabarti, Nakul Sinha, Dr. G.S. Wander, Dr. Tiny Nair, etc., who collaborated with me to put a very good scientific program. The program was structured into various sections and sessions, including epidemiology, the risk from hypertension and comorbidities, the prevalence of these risk factors within Indian subcontinent, and the sessions were also dedicated to proper diagnosis of hypertension in clinical practice, proper evaluation and appropriate management strategies, both non-pharmacological as well as pharmacological treatments. So the entire spectrum of hypertension, the broad spectrum of hypertension was covered in this program. Anything that you can think about in hypertension was covered in this program, from the basic sciences to clinical sciences to therapeutic implications and to the benefit of the patient and the society. We discussed both primary and secondary forms of hypertension, resistant hypertension, different types of hypertension such as masked hypertension, hypertension in the young, hypertension in the elderly, all aspects of hypertension that you can think of, like hypertension encyclopedia, were discussed. We had some special topics this year on hypertension. One was how to calibrate the blood pressure machines that we use in the office, in the clinic, and how important it is to have a properly calibrated machine to make the correct diagnosis of hypertension. And this is an important step in the clinical diagnosis of hypertension and therefore its future management as well. In addition to this topic, we also had topics on artificial intelligence in hypertension, a field that is rapidly developing, and we had discussion on clinical applicability of artificial intelligence in hypertension. In addition to conventional and traditional therapies for hypertension based upon guidelines, there were also sessions dedicated to novel and new emerging drugs for the treatment of diabetes, for the treatment of hypertension, and for the treatment of comorbidities. So it discussed not only the present trends, but the future prospects of treating hypertension and comorbidities with new, novel, and developing molecules, and also different approaches to bring the blood pressure under control. So, ladies and gentlemen, we were able to cover during 3 days the broad book on hypertension or broad encyclopedia of hypertension due to wonderful faculty we had. The faculty from India and abroad was of very high caliber, and I offer my respect and gratitude to all the faculty members, speakers, session chairs, panelists, etc. It is because of them the program was successful. The program was sponsored by Indian Society of Hypertension, World Hypertension League, and European Society of Hypertension. All these organizations formed together helped us to launch this one of the best programs in hypertension. We also had responsibility to honor and recognize some important leaders in public health, in primary care, and specialties who have contributed immensely to their communities. So, 43 leaders from different parts of the country were chosen and were felicitated under the auspices of Indian Society of Hypertension, European Society of Hypertension, and World Hypertension League. We also had the privilege of bestowing a very special honor of recognition on Dr. Ashok Seth, who is a prominent cardiologist, not just in India, but globally. Dr. Ashok Seth's contributions to cardiovascular medicine are a legend all over the world, and he has brought very good name to our country, India. He is one of the top cardiologists, both in terms of preventive cardiology as well as interventional cardiology. He is a name to reckon with in cardiovascular medicine in the country. We had the distinct privilege to bestow him a special recognition for his enduring contributions to cardiovascular medicine and the impact of his contributions to protect and preserve the cardiovascular health of this nation. So that was also a very important event. Let me summarize, my friends, ladies and gentlemen, the Hypertension Summit, the Global Hypertension Summit 2025 was a remarkable success in terms of its scientific quality, scientific content, and deliberations, and also due to wonderful faculty and to excellent, superb audience who came and who interacted and who had important points for discussion, important questions that needed to be answered. I hope that we were able to respond to them as much as possible given the time constraints. The idea of this hypertension summit is to present the state of art on hypertension and how the scientific advances can be applied in a tangible, practical fashion to the society at large. I think to this extent, we have accomplished this objective based upon the feedback that we received from the attendees. More than 700 people attended the conference, and we continue to receive the feedback. We also received some comments on some new topics and how to further strengthen the program. And I'm sure that the scientific committee for the next year will take into consideration a very important constructive input that was given to us by the attendees. So let me again, in conclusion, the Global Hypertension Summit was an important event in the scientific endeavors of our country, and it appears to have contributed to a greater understanding and broader understanding of hypertension and comorbidities and how we can tackle them early on to prevent the onset and progression of the disease. Ultimately, whatever we have done at the summit has to reach the community level. All the physicians who attended, I'm sure, will translate these advances to the maximum benefit of their patients, family, community, and nation at large. So let me thank you for your attention, and hopefully we will have a hypertension summit again next year, which will match your expectations and needs. Thank you very much, and all of you have a good day and be safe. Thank you.